All right. So, for everyone who is going to be watching this, this is something me and my wife, Brittany, decided to do to help explain what's happened so far and what is going to be happening in the future, most likely. This is a great way to document things and keep people updated on what's going on with us. So we're just going to start by telling what's happened so far with everything. Back in May, I noticed I was having some pain and sensitivity issues in my testicles. So after consulting with my wife,
It wasn't a consult. It was I was forcing you to go to the doctors.
Because like most guys out there, I'm not a huge fan of doctors. Plus, being in the military, it's just not fun always going to the doctor for something that is highly suspicious. Is the best way to put it. So went to the doctor. They looked at my testicle and obviously asked questions of history, have I been hit there lately or anything like that, because it was very large and swollen.
Which is very possible because of our two little ones who are 3 and 4. They like to take nut shots.
Without a doubt, a lot of nut shots. So went to the doctor. He immediately referred me to go to get an ultrasound done. And with that, they told me that depending on what the results were, whether I'd be going to see a urologist or not. The next day, I had my ultrasound, and we waited 2 days to hear results.
You had your ultrasound done in the morning, and they called us by like 12:30, 1 o'clock in the afternoon, and said that they had found something
suspicious.
But the way that the doctor put it wasn't suspicious. It could be nothing, or it could be something. How did he put it? Very bad.
They told me verbatim. They told me it could be as much as a bruise or contusion to something very nasty.
I wasn't happy about the wording of that.
Not the best way to put things. So the next day, I went in and actually had a face-to-face with the doctor who called me. And that's when they pretty much told me that it is a very high likelihood that I have cancer. That what I was experiencing was a cancerous tumor in my testicles. And then the next Thursday, I had an appointment with a surgical urologist.
And in the meantime, everything was swelling and becoming more painful
by the day. So that Thursday, we went and saw the urologist, unfortunately, because of COVID and coronavirus. Brittany could not be with me in that doctor's appointment. She had to wait outside.
But I was outside.
And be on speakerphone with me and the doctor. And when he looked at my ultrasound before he ever came in the room, so as soon as he came in the room, he told me that I was going to have surgery to have that testicle removed.
And that surgery is called an orchiectomy. Or a radical orchiectomy.
He then told me that in his 30 plus years of practicing urological medicine and being a surgeon, that he was 90 to 95% sure that it was cancer.
It was more unlikely for it to not be cancer.
That he would be shocked if it wasn't cancer, were his words. So he scheduled surgery for the following Monday, which was June 8th.
But 2 days prior.
And before I had surgery, they got a CT scan on me done, and that came back clear at the time. And then on Saturday, before surgery, I married this wonderfully beautiful woman. So that happened, not unplanned, but quicker than planned. We had a plan to get married a couple weeks later in June, on June
the
20th. So we bumped that up with everything pending and what was going on.
And we bumped it up just because with all of the unknowns in the situation in general, and on top of that having to deal with the coronavirus and COVID-19, me not being legally married to you makes things 20 times more difficult. I can't be your advocate. I can't be at any appointment regardless, but at least they would be able to tell me something.
Right. So
it's not like we weren't going to get married anyway.
Exactly.
It's kind of stuck with me anyway.
So we went ahead and got married, and then on Monday, I went to the hospital at 11.
Yeah, it was like 11.
And was back in surgery about 1:30, 2 o'clock. Came home that same day. She picked me up from the hospital there. She couldn't be at any of that. She dropped me off and then picked me up after when I was loopy as all get out.
Worst 4.5 hours of my life because I had no idea. There was no nurses coming out to tell me, hey, he made it out of surgery, he's going into recovery. It was just a waiting game of just being, we lived, 25, 30 minutes away from the hospital.
Yeah.
But it was just a waiting game. And definitely hard.
So I had the surgery. They told me it would be 7 to 10 days till we got the pathology results back, which it was exactly 7 days before we got them back. And my doctor called me then. He explained to us that it was cancer. It's a mixed germ cell non-seminoous tumor. Mm-hmm. Which was made up of teratoma is one of the types of cancers, yolk sac carcinoma as another type of cancer, and what was the
I'd have to grab the pathology report, but teratoma or embryonal or something.
Embryonal carcinoma.
All words that we can't pronounce.
Yeah, large, big doctor words that all mean cancer. And from there, obviously we had questions. Is multiple types of cancer normal? Is these specific types of cancer normal?
Is a specific kind aggressive? What is the outlook? Is this not typical for someone his age to have testicular cancer and these types of cancers? Was really it was hard. And they mentioned stuff on the pathology report vascular invasion, mm-hmm. Which that was not explained to us, and we'll get to that until our second opinion. So trying to decipher and decode and understand a pathology report, not being anyone in the medical field, is really hard to comprehend. So your mind is racing and you're just trying to figure out what is going on inside of your body and what the best options to be are. What are we faced with now?
It was definitely scary for me, and I know for her as well, hearing you have 3 different types of cancer. We didn't even know that was a thing or a possibility, but the more research we found
common
on testicular cancer, it is very common, especially for the age range I was in, which is already a very high possibility that if you're having pain or issues in your testicles at my age, that it is going to be testicular cancer. The age range is 15 to 35 are the most common cases in white males. 90% of cases are white males. Mm-hmm. About 10,000 cases in the U.S. every year. Some other stats our doctors gave us were...
and these are not necessarily accurate. This is just all from what we remember, so you can Google it yourself.
But the U.S. and Finland and Sweden are the top countries for testicular cancer.
Sweden?
Sweetened. So don't eat too much chocolate. But the following weeks after getting the pathology report back, they immediately jumped on getting me appointments with
oncologist, which there's more than one oncologist.
Different
there's
oncologist.
A surgical oncologist, there's medical oncologist. So the whole time we were waiting for our appointment, we thought that it was just an oncologist appointment, and come to find out, our first oncologist appointment was with a surgical oncologist.
And the surgical oncologist appointment, it definitely took us by surprise, because it wasn't what we were expecting to be meeting with a surgeon necessarily. So we couldn't answer all of our questions that we really had at that point. So we had to wait another week for our medical oncologist appointment, which broke down more of, found out officially what stage I was then, which was a stage 1B. And it gives you different options of what you can do treatment-wise at that point.
And it's all cookie cutter standard. Here are your 3 options.
The 3 options were to do surveillance, which is scans and blood work every 2 to 3 months, depending on what your doctor wants you to do. I could have had a major surgery known as retroperitoneal lymph node dissection.
RPLND for short.
Yeah, it's a mouthful, but it's basically, so with everything they know about testicular cancer, this is a cancer they know a lot about. It spreads first, and I guess quickly, if it is an aggressive type, to your lymph nodes in your retroperitoneal. Sorry if I'm murdering that word for medical people. Region, which is your lymph nodes that are in your back. They're above your kidneys, but behind all of your intestines and all your stuff right there in the middle of your gut.
And there's 2 options of how to get that surgery.
You can either do robotically, which is what the first surgeon talked about doing, or you can do it normal traditional surgical way, where they cut you from sternum to pelvis bone, and literally just move all your insides so they can get access to your lymph nodes. Different places do different techniques, choose to do it different ways, and what they think is the best way to do it.
There's a lot of risks and different outcomes as far as traditional or robotic. And one thing we personally found from our research is that if it's done the robotic way, they don't necessarily get everything, and it could not necessarily all be gone. Like there still could be like cells there, and instead of when they're in there taking out all the lymph nodes, they could just, take 1 or 2, but there could be cells still left there.
So about a week after the appointment, we and obviously the third option with stage 1B is chemotherapy, which everybody knows is a very common cancer treatment. That is for all types of cancer, chemo is a treatment.
Specifically BEP for testicular cancer.
Yeah, and
very common.
Yeah, the combination or concoction of chemo drugs they would use, and very harsh side effects, without a doubt. So after meeting with the medical oncologist a week later, finding out those options and everything like that, we
which that medical oncologist kind of just pushed the chemo. Like if it was my brother, I would say do 1 round of the chemo, which I think is important to keep in mind when we got to our second opinion. But sometimes you can just tell from a person, or over the phone, in person, however, it's just something's not sitting right with you. And that's something that I really pushed for during that appointment. When he walked out of the appointment, I was just like, I'm not comfortable. I don't like how pushy she was about it, because she wanted us to basically make a decision right then and there what we were going to do for his treatment plan. And something with all of those options I think is important is to really digest the information and to do your research And something that your mom had said on the phone to us is, whatever decision that you make sure that you're at peace with it. And I think that that is something also that like really stuck out in it so far in this process.
Without a doubt. And after that appointment, we immediately reached out to our medical
Care team.
That I have through the base here in New Jersey, which they've been great. They've gone above and beyond, pushing for getting me appointments and stuff like that very quickly. And then we got an appointment for a second opinion with Dr. Vaughn. And
can we tell them about that pass?
No.
Come on, please.
No. So, after discussion, she can tell the story of getting her a pass. Because this was the first hospital we even had the opportunity or chance for her to be at the appointment with me, with the doctor, and at the hospital. So, go ahead and tell your story.
So essentially, I was on the phone making the appointment for the University of Penn. And because it's in Pennsylvania and not in New Jersey where we live, we, asked if I could come to the appointment. He hates me for this, but he really does love me. It's funny, I promise. So I was on the phone and I said, can I come? And she said, well, if your husband has a disability as far as like needs help with mobility, getting around, or, emotional support or something. And for lack of better terms, I'm a smartass. So I was like, how does comprehension issues fall into play with all of this? So she is on the phone and she was like, yeah, that'll work. And he is outside walking, pacing around me, and he's like going like, really? And I'm like, I didn't call you retarded. And so she starts cracking up on the phone and she was like, don't worry, we got you.
Anyway. So yes, we made the lady crack up and she got laughs out of it, which is important. But then we finally got our pass and she got approved to go, which was great. And that was our whole goal with that, because I think it's very important, despite COVID and coronavirus, to have your support system with you as much as possible. So we went to UPenn in Philly to an appointment with Dr. Vaughn for our second opinion. He was very thorough with everything he did.
First doctor who's ever given him an actual physical, head to toe.
Looked over scar from the previous surgery, made sure everything was healing right, which it was, and everything with that surgery has been
so far so good.
Very good. I haven't had any post-surgery issues whatsoever from the orchiectomy, and he looked over my CT scan, confirmed that it was mostly clear except for one or two lymph nodes that were very suspicious, as they like to say. They like to use the word suspicious a lot, because not everything in the cancer world you can biopsy or really get a good look at, besides just radiology imaging. Mm-hmm. So discussing options with him, he gave us the same options. We can,
but he put them a lot differently.
That we could either do the surveillance, do the RPL&D surgery, or do the chemo. His take on the chemo was different. The previous doctor wanted to do just one round of chemo and be done. He, in his opinion, was, with what he saw on the scan and the lymph nodes, that one round would not be enough to confidently kill everything that could potentially be there. So he said he would do 3 rounds at least. Because one of the things he said, this really stuck with me a lot, and I know Brittany as well, is that he's not just wanting to treat me, he wants to cure me of this cancer. I'm 33 years old and have a lot of life left, and he wants me to be able to have a worry-free life from cancer. So from there, we talked more about the options, and with what I told him at the time, I told him that what I personally wanted for treatment was to avoid chemo at all costs. And that's when he broke it down in the sense of, well, then your two options are surveillance or surgery. But with already having lymph nodes that were suspicious, surveillance is really iffy, because if we waited too long between scans or anything like that, my lymph nodes may get too big for surgery to happen right off the bat, and I would have to get chemo.
All right, and there's
surgery.
There's different complications as far as getting the surgery pre-chemo or post-chemo. There's different like risks associated with that.
Fast forward to this week.
August 5th.
August 5th. This past Wednesday, which was the what?
I just said it. August 5th.
Okay. No. I didn't know if you were saying Monday was the 5th. I don't know. I lose with track of what day it is.
Quarantine doesn't help with that either.
No. Went and got another CT scan done because Dr. Vaughn said before surgery, because that's the decision we had made to have the RPL&D surgery.
And our consult had been set up for like 3 weeks for the 7th of August to see Dr. I think his name's Guzzo. Guzzo, I think is how you say his last name.
And he was like, we're going to need another scan before surgery or talking to the surgeon to make sure the lymph nodes are still good and viable for surgery. So ignore the bugs. It's summer in Jersey. So we had the scan done on Wednesday, the 5th. And 2 hours later, I got a call from Dr. Vaughn's office and the nurse practitioner there telling me that that I now have 4 small nodules in my lungs, and that they were wanting to cancel the appointment with the surgeon because surgery is really not an option at this point anymore. That we know 90% sure that it is the cancer metastasizing in my lungs, which is the word they use for cancer spreading to other things and being present. But they're still very small. They're only 5 millimeters each.
But they're there.
They're definitely there.
In 8 weeks, they have gone from nothing to...
Yeah, and he told us, looked at both scans side by side, and that 8 weeks ago these nodules were not there.
Yeah, because a question that I had asked was, is it possible that the place where we got the first imaging done at, like, could have missed it, like, because it was maybe an older machine or something? And he was just like, 1, he could understand, but not 4.
So, that's kind of where we are now. We have an appointment at 7:30, bright and early in the morning in Philadelphia.
I'm such a morning person.
Which would be the 13th?
No, 10th. You can't math.
I don't math.
You don't math.
No. And if any of my high school math teachers see this, they'll know. But
where do I need to talk to your spelling teacher?
Anyway, so that's where we're at now. We're going on Monday to discuss treatment options as far as what is actually going to be going on with chemo, because that's the
How
treatment
many
option.
rounds? When do we start?
That's the treatment option we're at now.
We're also waiting on blood work. The tumor markers, they wanted to run them along with another, with the scan that we got done on Wednesday. But after the scan, they wanted more blood work to see where his tumor markers were at, because after his orchiectomy, his blood markers were high. And then, what did we get the blood work done like a week after your surgery? And they went down into a normal range, which was like a really good sign that, like, okay, we got the tumor. It hasn't spread anywhere else. Like, we got it. And unfortunately, that's not looking like what's happened, and we'll do whatever we need to do.
Yep. I mean, I'm gonna fight this thing with everything I have, and I know with everybody's support, and especially Brittany's support, and all my other immediate family and friends out there that could be potentially watching this. You know, I've got this, and I'm gonna beat this. There's no doubt about that. But this is something we thought we would do to help keep everybody informed and updated on it, and we'll do it as often as you want, or as much
Or
as
if you
we
hate
think
our
there needs to be
humor,
updated. Yeah,
you don't have to do it at all.
or you know, you just don't like seeing me here. That's fine. But yeah, so hopefully this goes well, and we'll document the chemo journey and everything like that. It'll be a whole lot of changes to me physically, you'll see, I'm sure, over the course of these videos and everything like that. I mean, I'm already going bald, so I mean, missing the hair ain't gonna be that big of a deal.
We also just want, we've talked about it a lot recently, that we don't think that testicular cancer in general is like really talked about the way that it should be. I mean, you always hear about, you know, breast cancer and all the, you know, multiple myelomas and everything
lymphomas,
else.
Non-Hodgkin's lymphomas.
But it's almost like, I don't know if it's a pride thing that men just don't want to talk about it. But it's something that does need to be talked about, and it's something that as women, in my opinion, need to know for their sons, you know?
We've seen several posts of teenagers, 15, 16, I think the youngest I've seen was like 12 or 13 years old, finding out they had this cancer. So, you know, moms out there, you need to not be afraid to talk to your sons.
Check your balls.
About checking their balls and what they need to be feeling for, or stuff like that. I think us as, I mean, a general Southern male population, you don't talk about medical stuff, but it's something
Suck it up and deal with it.
Yeah, this is something we don't talk about enough, and testicular cancer is a real thing out there for a lot of people in their 30s and 20s, and it needs to be pushed. We want to be advocates for this.
We're ball advocates.
Check your nuts. But I think that's all we have for now. So I'm sure we'll do this again, and hopefully we'll get better at it.
Yeah. You're okay.
I said a lot, so sorry.
All right. Anything else?
I think we're good.
All right.
Till next
Love
time.
you all.